All right, so we're going to talk now in the next few sections about upper respiratory tract disorders. What we're going to do is start at the top, work our way down, and then we're going to talk about systemic disorders that have a major impact on the respiratory tract. So hopefully that will help you keep the information organized. And then the final piece of this lecture is going to be respiratory emergencies. So upper respiratory tract disorders, nasopharyngitis. Okay, I want you to break that word down. This is inflammation in the nose and throat. So usually this is a cold, right? This can be viral or it can be allergic. So it can be a cold, but we also can have allergic nasopharyngitis. How many of you already have that? Okay. So the pathophysiology, this is inflammation of the nose and the nasopharynx that causes swelling, discomfort, and exudate. If it is infectious, then that infection can continue to move down the respiratory tract. So this can develop into a lower respiratory infection. What does this look like? If it's infectious, they're likely to have a fever. Other than that, a runny or stuffy nose, or sometimes alternating, they do both. Sore throat, malaise is the feel bads. If they have a lot of itching in the nose, throat, eyes, that can indicate that it's allergic. Medical management, these are going to be self-limited. So managing the fever, comfort, just keeping them comfortable, keeping the nose clear, infection control, those kind of things. Now, if someone has a cough with mucus, we want them to avoid cough suppressants, because if we suppress the cough, the mucus sits there and gets thicker and can become a site for infection. If they have an infection, we want them to avoid antihistamines. Antihistamines may be helpful if allergy is the cause, but if they have an infection, antihistamines tend to dry out the secretions and again make it harder to get them up. And then if they have a viral infection, we want to avoid antibiotics. Nursing care, this is prevention, lots of hand washing, keep sick kids home, humidify and hydrate, comfort measures, teach home care, and reassurance, especially for babies when they have their first cold. Parents tend to get stressed out. Okay, next in this section is rhino sinusitis. So if we started with nasopharyngitis, that's nose and throat. Now rhino sinusitis, rhinos also nose and sinuses. Okay, usually this is viral. Kids who have allergies make a lot of secretions in their nose and sinuses, and so that can also contribute. And sometimes if their sinuses are not draining well, they can have a secondary bacterial infection. So what happens? Whatever organism is causing these symptoms colonizes the sinuses. What does that look like? Well, now we've got pain. They can have facial pain, but sometimes people who have dental pain or think they're having dental pain, it actually turns out it's from the sinuses. The pain worsens when they bend over. They may bend over and feel like somebody's sticking an ice pick into their brain. They may have nasal drainage, and it may have maybe purulent, may have pus in it. They may also have drainage that drips down the back of the throat, that postnasal drip. So postnasal drip, they may not realize there's mucus going there, but it can cause a chronic cough. And it also, all that mucus going down to the stomach can cause nausea. They may have a sore throat, fever. They may have redness or swelling in the throat or in the face. So medical management, we really need to get the sinuses drained out. So decongestants may be used, intranasal steroids may be used, and patients who have chronic sinusitis or frequent sinusitis may be using those nasal steroids routinely. Antihistamines, if this is allergic, can help because they can decrease that swelling. Leukotriene inhibitors like Singulair can help, again, if it's allergic. Mast cell stabilizers like cromolyn. I've got decongestants down there twice. Fever, and if it's bacteria, dealing with the fever, and if it's bacteria, antibiotics. There is a surgery for patients who have chronic sinusitis. It's an endoscopic debridement. They go in and just clean out the sinuses. And that can decrease episodes for up to 5 years or so. Nursing care for sinusitis, teaching what to do, what not to do. So we talked about, one thing we talked about was antihistamines, which can help if there's a lot of swelling due to allergy. But remember, antihistamines also dry out that mucus. And so antihistamines can trigger sinusitis for some people if it's drying out the secretion so they won't drain. So teaching about what meds to use, when to use them, what not to use, teaching about other interventions that might relieve that pain. Nasal irrigation may be used. Hot packs or warm packs on the face can be helpful in helping with pain, and also to help encourage drainage. Make sure that parents know how to safely use warmth. Rest, hydration, sleeping with the head of bed elevated. Avoiding cigarette smoke, because cigarette exposure makes this a lot worse. And infection control. So what to do with those tissues and things like that. All right, in the next section, we're going to move down a little bit and talk about throat pharyngitis.